Can you do this after ACL surgery? Around 2 months. This is called a heel pop. And a heel pop is when you squeeze your quad, push your knee down, and your heel pops up. So now you go into hyperextension. This is very important after ACL surgery because if you don't have this, it's going to be hard to really activate the quads, and sometimes it's hard to even walk normally. So this heel pop forces us to go into that hyperextension controlled. You're using the quad to lift up the heel past that 0 degrees. So this is 0 degrees, and then when you squeeze, push down, that elevates. And you want to have almost similar to compare to your other side. So if your other side goes way higher and this one doesn't go as high, there's a fact that we have to look into that. But we're going to show you, if you can't do this after ACL surgery, we're going to show you how to do it with just a foam roller and a strap. But before we go into showing you how to do this and explain the differences, the important part about this heel pop is, like I mentioned, you need to achieve that terminal knee extension after ACL surgery. If you don't have it, walking is going to be hard, and activating the quads during exercise is going to be really hard as well. And this just allows proper gait movement and allows your knee to move fluidly through the motions. So we're going to go over and explain a little bit more about this heel pop. So there's 2 factors playing into the heel pop. One, you need to have full knee extension range of motion or hyperextension range of motion. So if you don't have the mobility, you can't even get here, that means the knee is stiff. So we need to work on mobility first. But if your knee, if I use my hand and I can lift up my leg and then it just comes back down, I try to squeeze my quad but it just comes back down, that means you're lacking that terminal knee extension strength. So if you try to use your hand, or someone like your PT tries to help you lift up the leg and it just can't, it's because the knee's stiff. Maybe the posterior capsule is a little limited. So I'm going to show you the stretch to help with that. And then if you can lift it up and you can't hold it there, it's because you're lacking strength. So we're going to show you one exercise for each of them. So if you can't get it up there, so meaning you can't use your hand, you have a therapist trying to help you and he can't get it, it's because we have a limitation in the mobility. Could be flexibility, could be a couple things, but I'm going to show you one thing that could help you out. So you're going to use a foam roller. You're going to throw your leg up here. And then you're going to use your hand to push down on the top of your thigh down, and you're going to feel a little stretch in the back of your knee. That's okay. It might be a little painful in the back after a couple minutes because we want to do this for 6 to 10 minutes, okay? Usually I tell people put an ice pack here, so it's going to help decrease the pain. And this could be a good way because, as you can see here, my heel's elevated, gravity's pushing down. I'm also using my hand to assist me getting that stretch here. And that's going to help us get that terminal knee extension, that hyperextension of the knee. So I'm going to push down, hold it there for a couple minutes. I should feel a stretch in the back. If I feel a stretch in the front or pain in the front, we got to look into why that's causing that pain, because it could be a cyclops lesion, it could be scar tissue in there, but we want to feel a stretch in the back of the knee, okay? And we want to get that terminal knee extension. So you want to hold this for 6 to 10 minutes. So this is very important so we can get the mobility before we start strengthening that. So first, start off with the mobility. So this is going to help you get to this motion. Not activating the muscle yet, just to be able to do that. And if you want to learn different types of exercises or drills to help with getting that knee even straighter, click the link below in our description. We have a whole video on how to get your knee straight after ACL. But this is a good stretch. This is our go-to stretch. Just grab a foam roller, anything that elevates your heel, and just let gravity push you down and use your hand to assist you even more. So that's the first part. Once you get the first part, the second part is we're going to be working on the strength. So we're going to use a strap here, and we're going to put this strap right around our foot, and then we're going to squeeze our quad. So I'm squeezing my quad, and then I'm going to try to get my knee straight. So now, because I have the mobility, I'm going to try to get my knee a little straighter, and I'm going to squeeze my quad. I'm going to lift up my leg and assist with that. So I'm assisting with that activation. So this is pulling me into that hyperextension. You know how I mentioned, if you're able to lift up your leg, but you can't hold it, that means it's a strength issue. So I'm lifting up my leg, then I squeeze my quad, and I help myself assist that, maintain that. So I'm using my hands. So the big thing is, over time, you're gonna be less dependent on using your hands and this band to get the quad activation. So at first, you may only be able to do it this way, or using your hands too much. Then you'll be able to use more of your quads and less than your hands and lift up your leg. So we wanna just go slightly up. We don't wanna go all the way up, just enough to get that little movement of your quad, and you should feel that quad. You should feel a strong contraction here in your kneecap. You should even feel your kneecap move. But that's another exercise you can do to get the quad activated. So that's the first one. We're gonna add an extra one, a bonus one. So once you get that one down, you're feeling comfortable, then we're gonna go into the prone knee extension. So I'm gonna show you guys with my left knee, okay? So we're gonna go on our stomach, and we're gonna be in this position here, and my knee's bent, and what I'm gonna do is I'm gonna squeeze my quad to get my knees straight, okay? So my knee's bent, squeeze my quads, get my knees straight. So I wanna get my knees as straight as I can, I'm on my toes, come back down. Then you can go into a little plank with this. So I'm here, bending it, squeezing it, bending it, squeezing it. So this is all in the muscle activation portion of the heel pop. So just to kind of summarize what we talked about. So you need to be able to do this within 2 months. Get that heel pop, okay? Especially if you do it on your opposite leg. If you can't do it with your opposite leg, don't worry about it, but majority of the time, a lot of people can do it with their opposite leg, they can't do it with that operated leg. And that's because they lack two things. One of two things, or it could be two things. One, they don't have the mobility, so they can't get there. Or they don't have the strength. They have the mobility, but they don't have the terminal knee extension strength to maintain that. So if you're able to lift up your leg, but you can't maintain it, it's because you lack strength. If you can't lift up your leg, it's because you lack mobility. And that's what we went over. One, the foam roller to help with the mobility and to help with the strength, which a lot of people lack in that terminal knee extension strength, is the strap assisting you with that straight leg raise and that prone knee extension on your stomach squeezing. So hopefully you guys learned a little things about the heel pop, why it's very important after ACL surgery. We see a lot of people that don't get their knees straight after surgery. They worry too much about bending. So focus on getting that heel pop. You want to get it done by 2 months. That way it's a smooth sailing after that. So if you guys have any questions about a heel pop, and like I mentioned, just comment below, and that stretch, there should be relatively pain-free, only pain in the back of the knee, not in the front. Because if in the front, maybe dealing with some other issues like a cyclops lesion or anything else like that. So if you guys have any other questions about the heel pop or how to get your knees straight or how to get that quad stronger in that terminal or end range, comment below. We'll try to answer it with some videos or even add you guys into that ACL Q&A thing that we're going on. But hit the like button, subscribe button, share this with friends and family. We are the Basketball Doctors.